We still have a long way to go in our fight against COVID-19. The vaccine distribution to all of our residents is a complex undertaking with very high stakes. To date, we have received 4,500 doses of vaccine to the health department and have administered more than 2,600 of those doses. By Tuesday, 100% of our current allocation will be administered. Our community can now track our progress online via our COVID-19 dashboard at staycovidsafe.howardcountymd.gov. Again, that's staycovidsafe.howardcountymd.gov. We have estimated that there are approximately 5,000 to 7,000 people in Howard County's Phase 1A group, which includes frontline healthcare workers and our first responders. And based upon what we receive from the state, we anticipate completing Phase 1 by the end of this month. As the governor noted earlier this week, we receive our allotment from the state and are expecting more doses early next week to continue our clinics. I want to briefly explain how this process currently works, although things have and will continue to evolve. The state of Maryland has allocated vaccine from the federal government each week, and the state then allocates that vaccine to each local jurisdiction based upon a variety of factors. One factor includes how quickly and efficiently local jurisdictions are able to administer their doses. Just as we ramped up testing last spring, we are working to rapidly increase our ability to administer the vaccine. You may recall our initial goal last year was to conduct 6,500 COVID-19 diagnostic tests per week, which seemed impossible to some in April when we were doing 700 per week. Today, we are averaging more than 15,000 per week. We will bring that same determination and expertise to this vaccine rollout. This includes increased training of additional staff and volunteers, including the National Guard and our school system nurses, working through site selection and evaluating sites across Howard County, consistently communicating information through our health department, and working with our public and private partners to ensure that distribution is accessible to everyone as supply becomes available, including clinics that will begin to be offered 7 days a week. As we work locally to ramp up clinics and ensure we have adequate infrastructure and staff for vaccinations, we are also going to continue communicating with our residents before and during each vaccination phase to continuously improve this process together. Right now, we're still in Phase 1A, which includes all licensed and registered and certified healthcare providers, law enforcement, firefighters, EMS, nursing home residents and staff, correctional healthcare staff, and officers. The Howard County Health Department is responsible for vaccinating licensed providers and first responders. And as the governor noted, nursing homes are working with CVS and Walgreens through federal contracts, and hospitals have received their doses directly to vaccinate their staff. As I mentioned, a majority of this phase in Howard County is likely to be completed by the end of January, but will be ongoing. Phase 1B is approximately 30 to 40,000 people in Howard County. And that includes education, including our teachers and child care professionals, assisted living, group homes, other congregate facilities, continuity of government, and adults over the age of 75. The timeline for completion of 1B is currently March. Phase 1C is approximately 35 to 45,000 people and currently includes adults 65 to 74, public safety not covered in 1A, public health workers not covered in 1A, food, agricultural production, manufacturing, postal service, public transit, and grocery employees. It's too early at this time to accurately estimate a timeline for completion of 1C, but we hope it will be as early as May. Now, phase 2 includes adults 16 to 64 with underlying illness due to comorbidities, incarcerated adults, essential workers, and critical utilities, transportation logistics, and infrastructure. Phase 3 includes healthy adults 16 to 64. Now, I know that folks want to know exactly when they can expect to receive the vaccine. But right now, while they're still ramping up production at the federal level, there isn't a clear answer, and we do not want to convey a false sense of hope. However, as soon as we have a clear projection, we will share that information because we want this process to be open and transparent, but above all, safe and efficient. There has already been a lot of misinformation throughout this pandemic, and we are working to provide clear and concise information to our residents, especially about the efficacy and safety of these vaccines. To date, there has been little lead time on when we will receive more vaccine doses and how many doses to expect. However, we fully believe that as we continue to communicate and collaborate with our state and federal partners, that will improve. We're also communicating our needs around data with the state and ensuring that information is shared across jurisdictions because many of our residents work and live in different areas. And we need more clearly to understand how many people have been vaccinated so that we can move on to additional phases as an entire community. Over the coming months, please know that it is a top priority, and we are working incredibly hard as a team to administer as much vaccine as quickly as possible. I'd like to also remind our community that ultimately, we are not out of the woods yet. As we've seen over the past 2 months, the cold weather has forced more people indoors and accelerated the spread of COVID-19. And while we're still faring better than most of our other jurisdictions in Maryland, Howard County's positivity rate continues to be above 5%, currently at 7.4%, with case rates at 34.9 per 100,000. These metrics put us in a dangerous area of widespread community transmission. And we did not get to this point through luck or sheer coincidence. We worked hard to get to this point, and let's continue working hard to stay COVID safe. A vaccination effort of this scope, reach, and speed is historic. And it's going to take a unified effort from all levels of government, our healthcare community, as well as nonprofit and faith-based communities, and each and every one of our neighbors. To achieve our vaccination goals and to get to herd immunity as quickly as possible, this effort is going to not only need unity, but also education, understanding, and patience. There are many who need and want this vaccination as soon as possible. There are others, however, who remain skeptical and worried about taking the vaccine. We see a light at the end of the tunnel, and please know we're doing everything in our power to get through this pandemic and get back to a better life for all of us. Thank you.
I first want to start by what you're witnessing here are all our healthcare workers and first responders who all have appointments for today's clinic. They have signed up to be part of the beginning of the end of this pandemic. So I applaud our first responders and healthcare workers who are on the line getting vaccinated and who will continue to save the lives of others until we get to the end of this. I also want to thank partners, the police department, county government, fire and rescue, who are supporting us in this effort. And finally, I must take this opportunity to thank all of the Howard County Health Department staff who have been working every day since December 23rd when vaccine first arrived in Howard County. Knowing how important this asset is to restoring normalcy to our community, staff gave up holiday time, weekends, and vacation to develop and implement a plan to begin vaccination clinics that you are seeing today. We started with the first shipment of only 100 doses and have since received 2 additional shipments of 1,600 and 2,800 doses respectively. Shipments are received weekly. We do not know which vaccine we will receive, how much vaccine it will be, and when it will arrive until a few days before. This makes planning challenging for the following weeks. Vaccine remains limited, and you can see demand remains high. Maryland is currently vaccinating phase 1A priority groups. This includes all licensed, registered, and certified healthcare providers, law enforcement, firefighters, EMS, nursing home residents and staff, correctional healthcare, and officers in the judiciary. The health department team has been working diligently to plan and execute clinics that are safe and efficient. We have successfully vaccinated over 2,600 healthcare workers and first responders in the Group 1A over the past 5 days. We are vaccinating nearly 600 people every day at our location here at Ascend 1. At this time, our remaining clinics for the week are completely booked with healthcare providers. Our ability to continue this pace relies on the amount of vaccine, and we hope to receive weekly increasing amounts from the state. For those healthcare providers who live and/or work in Howard County, we ask that you visit our provider page on our COVID site and complete our questionnaire if you haven't already done so. You will be contacted with information about signing up for available clinics when we receive vaccine. As we hold clinics, plans are simultaneously underway to expand our clinic hours and locations. When we have completed priority group 1A, we will transition into vaccinating groups in phase 1B. We are hiring and training additional staff and volunteers, and will also utilize the talents of Howard County Public School nurses to assist at clinics, the National Guard, and volunteers when needed. We do not know exactly when vaccination of Priority 1B will begin. Currently, there is no pre-registration or waiting list for people who fall into Category 1B. When vaccinations for this group are to begin, we will broadly announce the registration process and provide further information about how to receive vaccine. The health department is committed to moving through this process as quickly, efficiently as possible, and safely, of course. We appreciate everyone's patience and cooperation. We will get through this by working together during these difficult times. Everyone who wants vaccine will eventually be vaccinated. It will just take time. Thank you.
And I just want to first start by extending my thanks to our partners, Dr. Rossman and Dr. Ball, for being such great advocates for vaccination and for helping to fight this pandemic in general. As you know, at the hospital, we are currently experiencing our second surge, so our staff is quite busy managing our patients and our community in that capacity as well as taking care of other acute issues that have essentially are non-COVID issues. As we move into this phase of the pandemic, vaccinations are very important for our acute care healthcare workers. Being vaccinated provides our staff, their families, and the community a level of comfort and protection. Since first receiving the vaccines in the middle of December, Howard County General Hospital has been working very diligently to vaccinate all of our high priority frontline healthcare workers in coordination with the Johns Hopkins Health System. The folks that want to receive the vaccine are eligible to and registered to receive the vaccine as we receive the supply. I am very proud of our teams who have worked on this logistical challenge over the holidays and currently. As the governor stated in his Tuesday press conference, Howard County is doing well with its vaccine distribution rates overall. I am pleased to say so is Howard County General Hospital. At this point, hospitals in Maryland are tasked with administering the vaccine to their own staff members. Therefore, at this time, we are unable to provide vaccinations to our patients or the general public. We are ready to support our community and county in the months ahead, and our leaders are involved in vaccine education and outreach efforts. I am personally co-moderating a program tonight in co-sponsorship with the Horizon Foundation that is providing education on vaccinations, and Dr. Rossman will actually be one of our expert speakers. So we are hoping that the public will take part and learn more about vaccinations in general. But again, I thank you all for your cooperation and the community in general. Thank you.
And now we'll open it up to questions from the press.
So the supply of the vaccine is actually slowing down the process. If you had more product, this pace would really pick up. And is there anything you can do about that? Or
Sure.
we can do about it?
The question is, please speak to the supply issues of how it is slowing down the process and what we're prepared to do should we have more supply.
And is there anything the state can do to increase that supply?
And what can the state do to increase that supply?
Great question. Yes, supply is limited throughout the country, including Maryland and Howard County. First, the feds send the supply to the state, and then the state sends it to the various jurisdictions. As the governor indicated, there are numerous factors that are considered, including how efficient a jurisdiction is with getting out the vaccine. To date, Howard County has been one of the most efficient in the state, and we are continuing to ramp up efforts. As the state continues to get more supply from the federal government, I fully anticipate we will get more supply from the state.
Are the vaccinations?
Next question.
I'm sorry. Are the vaccinations? We're now in phase 1A, voluntary, and if someone, I don't know if you have a rate of how many people have rejected taking the vaccine thus far, but do they get bypassed at that point? Are you going to just keep moving if there are people who don't wish to take the vaccine?
The question is in phase 1A, are these vaccinations voluntary, and should a person opt out, what is the protocol?
Sure. At this point, vaccination is voluntary for all Americans. It's strongly encouraged, but not mandatory. So we don't know who we're missing. Obviously, the demand is high. And when the demand for 1A goes down because we've essentially gotten everyone that is interested, we will transition to 1B. I ask everyone to consider getting vaccinated, educate yourself about the vaccine to make the best decision for you.
Next question. Yes.
I wanted to clarify the process. Is this all through the county? I mean, I just understood from the doctor that there's another track at the hospital. Could you describe, I mean, is it all being coordinated through the county, or is it are there multiple tracks that are going on?
Right. Please describe the process in which a person can get registered and ultimately vaccinated, since there are various points of entry.
So there are two simultaneous tracks, one through the hospital, one through the health department. The health department is working right now with first responders and medical professionals throughout Howard County. The hospital is actually vaccinating hospital staff. And right now, because of the limited quantity of vaccine, that's currently where we are in this phase 1A.
Next.
Some jurisdictions have both Pfizer and Moderna. What does Howard County have?
Please tell us what vaccines are being shipped to Howard County since Pfizer and Moderna are available.
Howard County Health Department has received so far all Moderna. Howard County General has received both Moderna and Pfizer.
Is there frustration about the pace of the rollout with circumstances that the county can't control, perhaps leadership at the federal level? Do you have any comments on that?
So the question that's coming is there frustration regarding aspects that are not able to control at the local level, such as state and federal aspects?
So many of us have been working throughout the nation through this global pandemic. Here in Howard County, we received our first confirmed case March 15th. It was a very long year for our community. There's a great deal of anxiety, and the physical distancing and having to do so much virtually is difficult on everyone. That has been exacerbated by the rollout at the federal level, and we are fully hopeful that as things ramp up at the federal level, that will then transition to the state level, which will then help us in Howard County administer the vaccine much more quickly and efficiently.
Thank you. We have time for one more question.
I have a question about the National Guard emergency response teams. A couple of days ago, the Governor Hogan mentioned that he was going to begin dispatching those to the jurisdictions. Have they arrived in Howard County? And if so, what is their role at this point?
The question is, has the National Guard deployed by the governor arrived to Howard County?
So Howard County has not requested the National Guard at this point because with the amount of vaccine we currently have, we can handle. However, when vaccine supply increases, we certainly will be requesting National Guard and other volunteers.
Okay, we want to thank everyone for joining today, all our press here, and also those who have joined on Facebook. This now concludes our press conference.